Hi, I am Dr. Pallavi Kalghadgi at Xenith Advanced Fertility Center. Now, are there some medications that a woman should avoid if she is trying to conceive or if she's already pregnant? There are medicines. Now, we all know that what medicines we take is definitely going to cross and reach the placenta and the baby. So, some of these medicines are known to have an adverse effect to the growth and lead to some growth or developmental abnormality to the growing fetus, and this is very common especially in the first trimester because that is the phase of organogenesis. So it is always better for a woman who is chronically taking any kind of medication to reconsider and visit a suitable physician before considering, and they should be done in the preconceptional stage, that is just when you're trying to conceive, to avoid any complications during pregnancy. To name a few of such medicines is firstly the anti-acne medicine, which is or the retinoid medication commonly called as the isotretinoin, and it is available in forms of creams, serums, tablets, and they are not FDA approved, or they are not safe to be consumed when you are trying to conceive or if you are already pregnant. Similarly, antihypertensives, there are various classes to antihypertensives, and there is only one particular class that is safe to be taken during pregnancy or if you are trying to conceive, and it is always advisable to switch over to the safe medicine much before, so that you're giving your body to acclimatize, to take time, and we will know if the dose is appropriate to maintain the blood pressure. So this kind of transition that your body would undergo, we would have time to modify the medication and the dose. Similarly, anti-diabetic medication. Now, insulin is absolutely safe to be taken. Similarly, metformin is also safe, but there are other classes of anti-diabetic treatment which is not safe and should also be changed or modified preconceptionally. Another important class of medication are the anti-anxiety medications, commonly known as the benzodiazepines. So they are also not safe to be taken during pregnancy and preconceptionally as well. These medicines would usually take some time for the woman to get used to. So if there is a switch of medication, you must consider the time the woman would need to adjust to the new tablets, and that is why it should be changed much before even trying to conceive. Similarly, lithium, which is commonly used for bipolar disorder, is also not safe, and it should be changed at the time of conception. There are many other medicines usually we take off the counter, like Combiflam, like ibuprofen, or any kind of NSAIDs. It is not advisable to take ibuprofen or any other kind of NSAIDs without consultation, without consulting the physician and your gynecologist, because they are not safe as well. Similarly, antibiotics, there are many antibiotics which are absolutely unsafe and should not be taken especially in the first trimester, because there are cause a lot of anomalies to the baby, and that's why it should be reconsidered. Now, some basic points or some basic understanding. This video is only giving you information. The actual recommendation should be from your treating physician and from your treating gynecologist. Always remember, do not take any medicines off the counter when you are trying to conceive, or if you are already pregnant, or if you think you are pregnant. Do not self-medicate because there are so many classes of medications, you wouldn't know which is safe and not safe. So do not try to self-medicate, and always get advice from a a professional, somebody who is professionally a doctor, because and don't listen to friends and family. Try to get absolutely authorized and professional advice. Remember, we are trying, I mean, the 9 months of your pregnancy should be a comfortable phase, should be an easy phase. So it's always better to optimize your health prior to conceiving, so that or preconceptional planning is important, so that the 9 months following your pregnancy is a beautiful journey with as less complications as possible. So I hope this video is helpful, and if you have any queries or if you have any questions regarding this, please feel free to get in touch with us and we will solve your queries. Thank you.